Another major update in the nation's fight against COVID. More booster shots are on the way.
CDC Director Dr. Rochelle Walensky signing off on boosters for both Moderna and Johnson & Johnson's vaccines. The authorization coming just a month after she authorized Pfizer's booster shots.
The boosters are really helpful. While the vaccines are working well in preventing severe infections, we are seeing breakthroughs, and we see very clear evidence now that boosters, especially for high-risk individuals, make an enormous difference in reducing those infections.
The CDC says nearly 15 million Americans who got the J&J shot will need to wait about 2 months until they can get in line for a booster. Now, for those who got the Moderna vaccine, they'll have to wait at least 6 months. Moderna's boosters can only be given to those 65 and older or people at risk of contracting the virus.
Well, in another highly anticipated decision, Americans will be allowed to mix and match their booster shots. That means no matter what shot you got, you can choose to get another vaccine when you go to get your booster. Experts say you should still discuss the decision with your physician or pharmacist before you get that jab.
What we know about mixing and matching is the following. First of all, it's very safe to do. Whatever set of vaccines you got first, you can get a different vaccine as a booster, and it's going to work fine.
Recent studies have shown people who got the Johnson & Johnson vaccine, then a booster from another shot, had significantly stronger antibodies than those who got the Johnson & Johnson booster. A new data from Pfizer also shows a third shot of its vaccine raises its effectiveness against symptomatic disease to more than 95%. The White House says there's currently enough doses to give a booster to all eligible adults.
If you want a booster, you can go to HY-VEE. Now, the company releasing a statement today saying they're ready to give those shots. The boosters are free to all eligible patients, regardless of their insurance coverage. Now, we want you to note you do need to meet the qualifications for those shots set out by the CDC. And to sweeten the deal, HY-VEE is offering a $10 gift card to patients who get vaccinated, including patients who got their booster. Meantime, Pfizer is releasing new data on the efficacy of its pediatric doses. The drug maker says the shot is 90% effective at protecting kids from infection. The announcement coming just days before an FDA panel is set to discuss the doses for kids ages 5 to 11. CDC Director Dr. Rochelle Walensky giving an update on a timeline for those shots.
We are waiting for the FDA regulatory process. They'll meet next week, and the CDC will actually meet the following week, the first week in November.
Now, if authorized, the White House says those shots could start rolling out as early as the start of next month. Officials say they plan to discuss vaccines for kids younger than 5 in early 2022.
As we await those pediatric doses, health experts say they are trying to ease nerves surrounding the shots. One of the biggest hurdles, convincing parents to get their kids vaccinated. Public health officials say they want parents to know the shots are both safe and effective.
Vaccine hesitancy has become a really big obstacle to getting everybody vaccinated, adults and children.
We're preparing a national public education campaign that will meet parents where they are with information about the vaccines.
Experts say the rollout plan may also curb some of that vaccine hesitancy. Instead of mass vaccination clinics, children will get their shots at schools, pharmacies, or from their pediatrician.